I'm Austine Oywer, a medical officer and an ENT resident partnering with Ponea Health. Today, we'll discuss about ear infections. Ear infections are broadly divided into two types, where you can have acute infections that occur within 14 days of your presentation to a hospital, or chronic infections that have lasted more than 14. Some of the predisposing factors to ear infections include upper respiratory tract infections, where the infection might ascend up your eustachian tube and end up in your middle ear, hence causing an infection. The other predisposing factors, especially in children, would be like in bottle feeding, where the children are not propped up and they might end up having infections in the ear through the eustachian tube into the middle ear. The other predisposing factors are mainly immunosuppressive conditions, such as diabetes or patients who are using drugs that are suppressing their immune system. Some patients also experience reflux, where some of the gastric contents might rise towards your nasopharynx and end up in your ear. Sometimes patients may also have injuries to their ear canal or the tympanic membrane, rather known as the eardrum, where it's perforated and bacteria are able to access the middle ear and cause infections. The commonest cause of ear infections are usually microorganisms, which are either bacteria or fungi. Some of the bacteria include Streptococcus and Haemophilus influenza. Some of the symptoms of ear infections include 1, a fever, especially in children, where you'll notice the child has hotness of body. The child may also be crying and tugging on the ear, and you might also notice an ear discharge, which may be pus. In adults, they may complain of pain in the ear. They may also complain of hearing loss, and they may also have the discharge in addition to having the fever. Some of the tips on preventing ear infections would include 1, avoid using instruments that will injure your ear, for example, using biro caps and inserting sharp objects in your ear. Number 2, treating any reflux conditions. 3, treating any immunosuppressive conditions. Management of the ear infections will include 1, when you present to a hospital, we'll have to take a comprehensive history and examine your ear. In the examination phase, we'll have to confirm if there's a pus discharge, if there are any other lesions, or if the tympanic membrane, rather called the eardrum, is intact. Then, if we find pus, we'll have to mop your ear, that is, get rid of most of the pus and examine the ear more carefully. Then we might put you on antibiotics, which will include ear drops and or including pain medication and medication to reduce your fever. Following this, we might have to do operations in the future to close the hole or the perforation in your eardrum if we find any. Thank you for joining us in this discussion. You may book our services through ponea.com. See you on the next episode.